In an assessment session, you will be encouraged to talk about your difficulties. The therapist will be trained to listen to you without criticising or judging you, and he or she will be helping you to speak about the dilemmas and the difficulties that have brought you into the therapy session. You might be feeling anxious, but the therapist will be creating a safe and secure confidential space, encouraging you to speak as openly and as freely as you can. The therapist will largely be concerned with two things, which is firstly to gather information to try and understand the nature of your distress, to try and understand what's happening, what's going on that's brought you to this position of seeking therapeutic help. But the therapist will also be trying to contextualise your distress, to try and understand it in a bigger picture, trying to understand what's going on inside your internal world and how that's reflected and impacted by the external world, the world that you're inhabiting. And the therapist will be trying to sort of weigh these two things up in order to assess what's the best therapy option for you, what's going to help you most. So, for example, someone may come into therapy with a very focused, specific problem that they've identified and they want to get some help with, such as a fear of flying or a fear of public speaking, something that's happening in their lives which is really holding them up and getting in the way. And that assessment might involve doing questionnaires. It might involve rating distress on scores of 1 to 10. It might involve paperwork as well as talking with your therapist so that the therapist can get a really full picture of what's going on. Alternatively, a client may come into therapy with a long history of abuse and ongoing current relationships which are destructive and very distressing for the client. And in this kind of assessment, the therapist might be focusing on trying to understand the longevity and the complexity of a family history and the context in which the client finds themselves repeating these destructive relationships. That kind of assessment might not involve questionnaires. It might be more of a talking assessment, trying to make sense of the narrative, of the story that surrounds this client's current distress. Whatever the nature of your problems, it's likely that the therapist will ask you certain things in the assessment session. The therapist will be trying to understand how your problems became manifest, how long they've been going on for you. They may inquire as to what therapy you've had in the past and what you found helpful, what you didn't. Have you consulted your GP? Are you taking any medication? The therapist may also want to know more about your interpersonal relationships, how your distress is impacting upon your private life, upon your professional life. And also they may be wanting to find out what your goals for the future are. What are you hoping to get from therapy, and where do you see yourself going after your therapy is being completed? Sometimes parts of your assessment might feel uncomfortable or upsetting, but it's important to remember that your therapist is trained to listen to your story and to stay present throughout it. Also important to remember that there is no obligation to tell all. This is not a confessional, the initial meeting. It's for you to try and talk about what's bringing you into the therapy, and sometimes you won't be able to say everything. This is particularly the case if there's been trauma or sexual abuse in your past. It might take you some time to build up the courage and the confidence to actually put words to some of the things that have happened to you. And if you can't speak about this in the first session, that's absolutely fine. Your therapist will be going at your pace. You won't be rushed, and you will not be forced to talk about anything that you're not comfortable talking about. Towards the end of your assessment session, your therapist is likely to sum up what you've talked about throughout the session and to discuss some of the practicalities going forward. So this will include frequency of sessions, the fee structure, your goals for the future. Your therapist may also suggest something called an assessment phase, which is an extended assessment, which is 2 or 3 sessions for you to get a feel for coming into therapy. You do 2 or 3 sessions which are still part of the assessment, but it gives the client the ability to feel what it's like to be in therapy, to have the regularity of the session and the space between the sessions, and to see what it's like having therapy in their ongoing day-to-day life. And it helps the therapist to deepen an understanding of the client, and together that they can collaborate in the work more easily. It's important to remember that an assessment is not a test, it's not a pass or a fail. You're trying to establish a collaborative relationship with a therapist, and the therapist and the client are working together towards this. You're not being judged or measured or tested. It's about seeing whether therapy is going to be helpful for you at this particular time with this particular therapist.